Do you know the services that a doula and a midwife provides and why having one can change your birthing experience? Well, in today's video, we're breaking it all down. Hi, my name is Tyiesha. I am a student here at SUNY Downstate School of Public Health, and I also work for the Arthur Ashe Institute for Urban Health. Today's video is featuring Janae Atkins, who is a doula, Gladys Christophe, who is the Director of Midwifery here at SUNY Downstate, and Dr. Ofable, who is the School of Public Health Associate Dean and Community Engagement, and also an Associate Professor. They will be talking about the services that they provide and why it is so important to have a strong care team, especially for Black and Brown pregnant individuals.
Hello, my name is Janae. I am a birth worker or doula, and I've been in this field for over a decade. I started off in the maternal health field as a family educator for those that were in the juvenile system, and then I segued into a full-time doula, also a childbirth educator, lactation consultant, and a holistic herbal apprentice. So what led me into doula work was my mentor. When I was in college, I had an amazing mentor who really took time to see me and understand a lot of my strengths and weaknesses. So in order to graduate, she introduced me to Chanel of Ancient Song, who I became her apprentice, and that started my journey as a doula. So some of the ways that I get to support mothers during their pregnancy, during birth, and during postpartum really starts with education, allowing them to know what to expect, what does it look like to give birth, what are some of the things that are absolutely normal during their pregnancy experiences, and what isn't normal. It's amazing to be able to go through a birth preference and learn what people knew already were their options or what may have not been given to them as an option. It's also an amazing time to be able to physically show up during the labor experience. As labor expertise, we're able to shift the labor dynamic by positioning moms and helping babies during that positioning, speeding along labors naturally by giving them comfort, support, massage techniques. And then when I think about postpartum, we kind of wrap it up in a package of being able to see moms when they get home, making sure that their breastfeeding journey is going well, or even if they chose to use formula, that they're learning all the techniques about how to bottle feed. I think also the full spectrum care that we give during the entire process is what is elevating a lot of moms to feel empowered in their decision making and their entire experience. Because birth is not just physical but also emotional and mental, having a doula in the room is having additional eyes and ears to your experience. Because it is such a sacred experience, we also provide the container to make sure that your birthing preferences and your needs are being met, allowing more joy and less fear in the room. So what keeps me passionate about supporting mothers? There's many things, but the first thing that I'll say is watching them react to the result of having support, watching them feel seen, watching them feel heard, watching a lot of their birth preferences and their birth desires actually play out with the right support. But I think what ultimately keeps me there is also recognizing how great the doula work and birth work community is and making sure that there's movement and change, but we're still not there yet. And so what keeps me passionate is recognizing how much we are still needed and how much work we still do in moving the needle. When I think about the challenge of being a doula, I think about all of the information that we learn and how much we see the benefit of having an OBGYN is, having a midwife, having a high-risk provider, having a doula. But the challenge lies in how do we integrate all of the care that we all give and all of the wisdom and knowledge that we all have to benefit the individual families that are seeing us. And then separate from that challenge is how do we make a living from doing this work, but full of integrity, full of purpose, and not being swayed by having to pay our bills, but really being swayed by wanting to work directly with the clients that come to us. So some challenges that Black and Brown mothers tend to face during pregnancy is a lack of quality care, a lack of quality foods, a lack of quality of time to spend with themselves and care for themselves, and then a lack of education, especially in our communities. So not listening to Black and Brown people during and after their birthing experiences and also not having an integrated system where the work of doulas, of OBs, of midwives, and other medical professionals are not respected and working in unison, I think deeply contributes to the maternal mortality crisis, amongst many things. One piece of advice that I would give Black and Brown mothers navigating their care is to trust their instincts, to listen to themselves, and to speak up. You are the one that knows your body, you know if something is wrong, and you have the ability to seek outside support if something does not feel right in the conversations and in the care that you're presently getting.
Hi, my name is Gladys Christoph. I am a certified nurse midwife, currently in the position of midwifery director here at Downstate Hospital. I have been practicing as a midwife for the past 34 years. At first I was in a hospital setting, and then I transitioned to work in a private practice at the HIP Center. And after 10 years, I transitioned here to Downstate, and I've been here ever since. And I'm going to be here until I retire. My inspiration to become a midwife started when I worked as a labor and delivery room nurse at Interfaith Medical Center. I watched the two midwives that were the only practicing midwives at that time, and I liked how they interacted with their patients. And actually, one of them recruited me. She kind of advised me. She asked me if I wanted to be a midwife, and I said, She said, "Yeah, I think you are qualified. You are suited for this position." And shortly after, I decided I was going to apply to midwifery school, and I did. I was accepted at Tyiesha Dorsett, and that's where I got my midwifery certificate from. As a midwife, we midwives provide prenatal care. We provide prenatal care, postpartum care, labor and delivery room care, reproductive health care, meaning contraception, prenatal care. When they come, we do. Not only do we do their prenatal assessment, we prescribe medication, their prenatal vitamins. If there's any infection, we treat the infection. We refer them to sonogram. Sometimes they need genetic counseling. We refer them to genetic counseling. And that's antepartum prenatal. We monitor the women through labor and delivery. We assist in their birth because they really are the ones doing their birth. We assist with their birth. If there is any issues with laceration, we don't really do episiotomies, but if there are lacerations, we repair the laceration. And postpartum, after the delivery, we check them. We check to make sure they are okay, the baby is okay, the baby is up to date with the pediatrician. We encourage and we check on their breastfeeding status, and offer contraception if they need it. And we make sure also that they follow up for if there's any medical issues before or during the pregnancy. We make sure they follow up with their primary care to care for this particular issue. And we also check on their mental status because of this growing risk of postpartum depression. And if there is any need for follow-up with psychiatrists, psychologists, or therapists, we will refer them to the social worker and continue with their care that way. Well, like everything, midwifery has its challenges too. First, we have some patients, they started the prenatal care and they lost their insurance. And a lot of times there's nothing I can do about it. And also sometimes another challenge is compliance. I sometimes I think they might have transferred to another hospital, but it turns out that some of them just decide not to come. And recently, I have patients that stopped coming for prenatal care because of the political situation in this country. But I do keep in touch, and between the social worker and the healthcare team here at Downstate, we try to communicate with them. And I think really this is the most challenging part, not the lack of compliance, and sometimes medication challenge too. Some of them don't want to take their vitamins, their iron for whatever reason, and despite what we say, or some of them don't want to do their lab work on time, and it's like forcing your child to eat something they don't like. So this is the most challenging part, but it's solvable, and I'm working with them along with the social worker. We try to call them, we try to contact them, and there can be some improvement, but I need more improvement in this situation. But anyone can benefit from having a midwife. However, there are patients that are not suitable for midwifery care. We can start, even if the patient is a high-risk patient, meaning they have an existing medical problem before the pregnancy, or if the problem developed during the pregnancy, such as gestational diabetes, we can either co-manage the patient with the physician, or we transfer the patient for the physician care. But anyone in the reproductive life cycle can benefit from a midwife. I've had midwives from young patients from age 13 to age 44, and I've managed them, and yeah, anybody who actually want a midwife, and we have patients. I actually had a patient one time that walked to the office who had a C-section, and she came to me and said, Ms. Christophe, I'm here because I want a VBAC. So that's a vaginal birth after a C-section. So I worked with her, and she did have a successful VBAC, and I was present, and together with her doula, we managed for her to have a very, very healthy birth. And I've seen her a couple of months ago, and I'm asking her when she's coming back. She said no. But this is what we do. When people ask for us, we deliver the care, and this is how I continue to manage. My advice to any pregnant woman is to speak up, communicate, tell your provider, tell your doula what is going on. And if one provider does not listen, you go to the other to find somebody else. Tell them, or go to the ED. Tell them, for the past 2 days I've had this headache, or my feet have been swollen, or I'm dizzy. Any symptoms you have, remember, you taking care of yourself and your unborn child. You need to communicate. When you come to us, we ask you, how is everything? You say, okay. We do look at your vitals, we look at your weight, we look at your labs. We do act accordingly, but the ultimate plan, decision will come from you. You need to tell us what is going on, whether physical or emotional, or if you feel less movement, if your feet were swollen, if you had a headache last night, whatever is happening, you need to let us know. Because sometimes your labs, your vital signs don't reflect what you are feeling. We will not know if you had a headache for 2 days, if you've been dizzy for 2 days. We do check your feet. However, sometimes when their feet do get swollen, but there are other symptoms that are associated with certain conditions when you're pregnant. You need to let us know.
Hello, my name is Amy Afable. I am an Associate Professor of Community Health Sciences and Associate Dean for Community Engagement at Downstate Health Sciences University School of Public Health. My expertise is in maternal health research, health equity research, and in community engaged research. The initiative in maternal health that I worked on is called We Care About Brooklyn, or WeCab. WeCab is an intervention prototype that I co-created with several community collaborators, including collaborators at the Arthur Ashe Institute for Urban Health, in particular Dr. Marilyn Frazier, as well as Dr. Christina Pardo, who was an obstetrician at Downstate and is now at Weill Cornell Medicine. WeCab is a community health worker-led intervention designed in order to address New York City's maternal health crisis. The maternal health crisis, unfortunately, is a result of a long history of systemic racism and historic marginalization of women of color. For those of you who do not know, Downstate is actually located in the epicenter of New York City's maternal health crisis. And so we designed the intervention in order to address the maternal health crisis. Community health workers are paired with pregnant individuals and provide precision support in the areas of social unmet needs. For example, women who are struggling with food insecurity or childcare, or who want a doula to support them during the pregnancy, community health workers are able to refer them to these particular needs that arise during women's pregnancies. Well, as I mentioned, a WeCab is designed to provide precision support to pregnant mothers. And part of that support is pairing pregnant persons to doulas who are available in the community. And so we view doulas and midwives as key individuals who can provide support throughout the mother's pregnancy. Doulas are viewed in this community as trusted individuals, and they're typically from the community, and they can serve as advocates to pregnant mothers who are often left behind in a fragmented care system, which is responsible for the maternal health crisis in New York City. So it's important to combine clinical care with community-based care because through our research that was funded to develop WeCab, we talked to many community health practitioners, including doulas, midwives, community health workers, and social workers. And they raise issues about the fragmentation of both the healthcare system as well as the social service sector. And when we speak to clinicians, they also raise similar issues, but they often felt ill-equipped to address the social or unmet social needs of pregnant persons. And so it's important to pair clinical care with community-based care because the community has expertise in providing resources and support in the area of unmet social needs. So if you have clinics and communities work together, we'll be able to meet, the needs of pregnant persons from a more comprehensive and holistic perspective and approach. So pregnant mothers should be aware that there are resources available to them if they are struggling during pregnancy, if they have any questions or concerns about warning signs or symptoms that they experience during pregnancy. These are all available online, or again, there are various interventions and community-based organizations that are available in the community that can provide resources for them.
I hope you enjoyed this video and you learned more about the services a doula and a midwife provides and why it's so important to have a strong care team, especially for Black and Brown pregnant individuals. Thank you so much to my guests, Dr. Fable, Ms. Gladys, and Janae, who were able to share some valuable information. And thank you for watching. Please share this video with someone who you know will find this information helpful. Thank you so much. Bye.